Hello, this is Group 10, bringing you our case study on breast cancer. Robbie Williams.
Brandon Lindeman.
Derek Rowland.
Just some brief patient history and a review of the main clinical problems. Melinda Wells, she's a 57-year-old female, mother of 2 adult daughters and a grandmother of 3. She is married as well. She recently went for a routine physical exam where her physician noted a lump in her left breast. Further actions were taken and surgery was performed where the left breast was removed along with all the associated lymph nodes. During the patient's post-operative recovery, she had radiation therapy. She had limited movements in her left arm, noting severe and recurrent problems with edema in her left upper extremity. Treatment was taken, pressure garments were applied, and therapy was utilized. She was diagnosed at that point with lymphedema. Patient had complaints of the arm feeling very heavy and ready to burst. She was eventually discharged to home, but she had complaints of balance issues due to the excess weight on her left side from the swelling. Patient also receiving radiation therapy where she drives 25 miles each way for treatment. At home, patient is confined to a reclining chair because of limited mobility and increased pain with standing, secondary to the effects of gravity acting on her left upper extremity. She has access to no durable medical equipment within her home. Patient complains of feeling depressed about her situation and her immobility. Specific body structure function impairments. Perception and cognition are within normal limits. Sensation and pain. The patient has complaints of hypersensitivity throughout her left upper extremity. She complains of pulling and bursting feeling in her left upper extremity due to the edema and swelling. The patient's skin integrity. There is marked pitting edema throughout the left upper extremity. Circumferential measurements were taken. Wrist measures of 24 centimeters, elbow circumference of 32 centimeters, and axillary area of 44 centimeters. These are specific to the left upper extremity. Contralateral measurements of the right upper extremity were not taken. Patient's balance. The patient is supported in static sitting. It's currently normal when the left upper extremity is in a sling. The patient has difficulty of dynamic balance and sitting due to the excess weight in her left upper extremity. In standing, the patient can be displaced by external perturbations and has complaints of discomfort in the left upper extremity. Specific mobility concerns. Bed mobility actions such as rolling, bridging, supine to sit, and access to transfer equipment. None of these were able to be performed. The patient refuses to lie in bed due to the discomfort of their pain and also fear of not being able to get up from these positions. Specific transfers. Sit to stand, the patient requires minimal assistance to support their left trunk and left upper extremity. From chair to standing, the patient requires minimal assistance to support their left trunk and left upper extremity. Toilet transfers to standing, the patient requires moderate assistance to support her trunk and left upper extremity. Bed, shower, and car transfers were not tested due to patient's complaints of pain and anxiety issues. Functional mobility. The patient ambulates with her left upper extremity in a sling. She requires minimal to moderate support of another for ambulation. All that is dependent on her level of fatigue and the distance she's required to walk. Patient can independently ambulate within her home. There is a moderate increase in her base of support with ambulation with minimal forward flexion of her hips. Self-care needs. Patient reports having a poor appetite. This could be secondary to the radiation and chemotherapy that she is going through. Patient reports that she would like to cut her own food because she claims that not feeding herself makes her feel really helpless. Bathing concerns. The patient requires maximal assistance of another for support of her upper and lower extremities to sit on a toilet to bathe. The sink in her home is located next to the toilet. The patient needs assistance to stand herself to perform washing activities. With these, she complains of fatigue, and also the patient reports not having much motivation to care for herself. Grooming concerns. After setup of toothbrush and other hygiene essentials, the patient is independently able to perform these. For dressing, she requires max assistance to don her dress and needs help snapping buttons down the front of it. She requires complete dependence for putting on her shoes, and she prefers not to wear underwear. Within her home, for other activities, the patient is completely dependent for cleaning and washing the dishes. During her leisure time, she enjoys just sitting and watching TV with her family and reports not sleeping well at night. Range of motion and strength measurements. The patient has limited left shoulder flexion, abduction, and external rotation. All remaining planes from her wrist. Distally, she has approximately 75% of functional range. In the contralateral extremity, the patient has with adequate normal range in all planes of motion at all joints in her right upper extremity, and bilaterally in her lower extremities, the patient has full functional range. For strength, the patient has good minus strength reportedly. She is able to hold a test position against slight and moderate resistance in all planes of the left neck, left trunk, and left upper extremities. On the contralateral side, right upper extremities have good strength and is within normal limits. Distally, in her hand, the patient has difficulty with fine motor tasks specifically to the left hand.
Alright, for plan of care with this patient, we're going to use the complete decongestive therapy. This therapy style combines manual lymph drainage, compression therapy, exercises, skin care, and education to treat lymphedema. There are two phases. There is the initial reductive phase, which kind of consists of the therapy processes. The goal is to reduce the overall size and improve the skin. In this case of the patient, we are going to prevent any type of skin breakdown in the future. Then there's the maintenance phase, which is the self-management program. So this would be like the home exercise program and individual what's the word I'm looking for? Self-massage. Alright, so manual lymph drainage. This is where the therapist goes in and he does like a light massage on the therapist. He typically opens the lymph nodes and the lymph systems in the left upper extremity, working proximal to distal, and then later on works distal back to proximal after they're opened up. This is a light subepidermal type of massage. It's believed that aggressive pressure may damage the lymph capillary network. There are many benefits to this. A few of them are to improve lymph transport capacity, redirect lymph towards collateral vessels and anastomoses. It gets uninvolved lymph regions involved and mobilizes the stationary lymph that has accumulated in the tissue. As far as frequency, the patient would perform or have manual lymph drainage performed 2 to 3 sessions per week for about 20 to 30 minutes. In the future, progression can be made to actually reduce the amount of manual lymph drainage as they get more independent in their own self-management. Compression therapy, this is the use of multi-layered short stretch bandaging to remove the excess lymph fluid. It's an added external gradient, typically stronger distally than proximally, and it works in junction with elevation to help drain the fluid. Some benefits of this technique are to maintain the fluid reduction at home after therapy, kind of maintain the benefits that you received after the MLD, and also improve muscle pump efficiency. Frequency, it should be worn 21 to 22 hours per day on the left upper extremity, just for an aggressive treatment style. And as far as progression, the patient already has a compression garment, but we want to stress the fact and the importance of wearing this garment as often as 21 to 22 hours per day. Exercise therapy, we want to begin with low intensity, high repetition left upper extremity exercises with the compression bandaging. The compression is used to counterbalance the buildup of interstitial fluid with movement, so that's very important. You want to work distal to proximal against gravity to move the lymph towards the heart. We'd start out with finger flexion and extension, move up to elbow and wrist flexion and extension, possible radial deviation, and as well as shoulder movements in all planes. Frequency, see the patient probably 3 to 4 times per week for therapy, but we also want to prescribe some type of home exercise activity so they can be active 6 to 7 times per week. And to progress the exercise therapy, maybe we'd start off with using gravity first to see how the patient responds and see how much pain they have, and then after all the MLDs, we can begin using resistance such as yellow TheraBand or lighter weights, and then progressing from there. Skincare is important. If the skin is good, then we can have continual bandaging and wrapping of compression garments, so it's important to not let any type of ulcers form or cellulitis. So the use of low pH lotion will be used to decrease fungus and bacteria, as well as keeping the skin moisturized and prevent cracking. This will be important to reduce infections, ulcers, cellulitis. In addition to that, we'd also want to stress education of self-massage, self-bandaging, a home exercise program, as well as fluid intake and nutritional benefits. The importance of fluid would be to flush out a lot of the toxins with the initial manual lymph drainage massage. Progression of the plan of care. First week would be low intensity, 2 to 3 times per week, 30-minute quick sessions, just to see how the patient responds to the treatment. Some side effects are possible secondary to toxin release with the compression and manual lymph drainage. The 2nd through 8th week, we'd want to increase probably up to moderate exercises as well as increase the intensity of the complete decongestive therapy. 2 to 3 sessions per week, 45 to 60-minute treatment sessions. We'd increase from gravity resistance to light bands and functional activities. And then we would possibly do some of the alternative therapy methods that will be discussed later on. From the 2nd to 3rd month, we would also increase to moderate to aggressive intensity exercises and improve self-management of symptoms. We would probably only be seeing this patient one time per week, maybe even one time per month, depending on how well they're doing at home with self-management of symptoms. As well as we'd have the patient have a home exercise program logbook to kind of track the adherence to the program. Some short-term goals that will be accomplished in 3 to 4 weeks. Reduce pitting edema and girth measurements by 10% in left upper extremity to reduce assistance with dressing from max to minimal assist. Improve strength from good minus to good in all left upper extremity movements in order to lower her body into the tub so she can bathe and partake in hygiene preparations. Patient will also only require moderate assistance for all bed mobility activities without any complaints of pain. This will also help with sleeping at night. Patient will be within functional limits in range of motion in her left shoulder to independently perform bilateral tasks with her upper extremities such as food and hygiene preparation. As far as long-term goals, these will be completed within 3 months. The patient will be able to perform daily home exercise program, self-massage, and be independent with application of compression garments 85% of the time, at least. Patient will also be able to perform dynamic balance in sitting without loss of balance while performing bilateral tasks such as tying shoes. Reduce pitting edema and girth measurements by 30% in left upper extremity to reduce assistance with dressing, self-care, and to perform other ADLs independently. All left upper extremity range of motion will be within 95% of contralateral upper extremity to assist with all independent transfers. Patient will also be able to independently walk in a community environment at least 1,000 feet without loss of balance or subjective complaints of fatigue.
Okay, so some of the age-related changes that are relevant for this case. As we learned in class, the most significant risk factor for developing cancer is age. Another factor is when we age, our body has a decreased ability to clear lymph from the system, and this can complicate our treatment for the lymphedema. And some of the psychosocial variables that pertain to this case, as was mentioned earlier, the patient is depressed with her condition, and she's also unsure on how to discuss it with her husband, and her husband is unsure how to discuss it with her. So her husband feels left out of the situation and is therefore unable to provide any support. Her daughters are also overwhelmed with grief. Anytime that they see her, they just sob and cry and are unable to provide any real support for her. So that leads us to some negative factors that are going to affect the rehabilitation. As was mentioned, the patient is not getting the family support, and she feels like she is defeated by her condition, and it's making her feel depressed. And when she feels like this, she will be less likely to perform her home exercise program or be compliant with our instructions. The lymphedema also adds to the patient's discomfort, and she says that it makes her feel like she cannot move. She's immobilized. It adds a fear of falling over because of the extra weight of the limb, and so she feels unstable.
Some of the positive factors for rehab, the family is there and they are available for support, but they are in need of education to be able to better understand the patient's condition and to help her cope with her condition and to help her get better. And the patient is now at home, that's where she wanted to be, so this may help her be more motivated to complete the home exercise programs and be compliant with treatments. When it comes to compensatory versus restorative rehab, there's going to be a little bit of both. Since the patient did have a removal of her lymph nodes, she's going to be continuously dealing with the lymphedema treatment. It's going to be something she's going to live with for the rest of her life, and she will need to keep on top of it to ensure that she does not have problems down the line. Also, since she has already been diagnosed with cancer once, she has an increased risk of getting cancer again, so this will be important for her to have routine checkups and keep an eye on that situation. For restorative care, the lymphedema can actually be treated quite well using manual drainage techniques with massage and the compression wrapping. So as long as this is done properly and she complies with the home exercise care and the learning how to do the compression wrapping herself, then she should not have a problem in decreasing the size of the left upper extremity. Okay, some of the articles that we found will be discussed next. The first one is on exercise and quality of life. This journal article was from Current Oncology, and it looked at the effects of exercise on breast cancer survivors who had chest wall and or breast pain, and also those patients' quality of life as measured on a survey scale. The findings from this article suggested that with aerobic exercise, patients had an increase in quality of life, and that measure persisted 1 month after the exercise test and up to 6 months after the exercise test when it was compared to a baseline and control group. One of the problems with this article was that it was a pilot study, so that there wasn't a lot of information to go off beforehand, and it had a limited number of subjects. I believe that this study looked at only 10 subjects for breast cancer survivors, so it's a very small pool of subjects, and that decreases its external validity. However, it did have good evidence for further investigation into this topic, and it suggests that future research should be done to determine the extent to which exercise can improve quality of life for breast cancer survivors.
All right, with my research study, the purpose was to determine if aqua therapy is a safe and effective treatment technique for patients with lymphedema post-breast cancer surgery. The findings were that aquatic therapy for lymphedema treatment is a safe way to treat women that suffer from mild to moderate lymphedema. Some of the other findings were that people who participated in aquatics had a much better adherence rate and improved quality of life. So as far as external validity, the study had 48 women with lymphedema post-mastectomy, and they were randomly assigned to a control or a treatment group, and it was a single-blind randomized clinical trial. As far as internal validity goes, the treatment group participated in a 45-minute, one time per week aquatic therapy session that focused on different exercises for moving the lymph out of the upper extremity. They did this for 3 months, while the control group just participated in a self-management program that had specific exercises, um, and then after the exercises, they were asked to fill out an adherence diary. Um, before they began the study, they also filled out, or they took measurements for the limb volume by using water displacement, and they filled out an upper limb lymphedema questionnaire. By the end of the research study, they redid all of these questionnaires and measurements and documented the adherence to the program. And what they found was that, unfortunately, there was a very poor adherence. I think there was only an average of 28% of the participants that participated in the self-management program. Um, but they did find out that there was an average reduction of 98 milliliters by the last aquatic therapy session in the treatment group, but the effects were not long lasting. So from the research, they were able to say that home exercise program is very important. As far as future research goes, I'd like to maybe have them look into the benefits of performing aquatic therapy maybe 2 or 3 times a week compared to 1 time per week, and then maybe compare it back to the 1 time per week to see if maybe there's better adherence or if there's more, maybe a longer lasting effect. So.
And the third research study was focused on cranial electrical stimulation, titled Pilot Study of Cranial Stimulation for Symptom Management in Breast Cancer. This was an article from the Oncology of Nursing Forum. The design study was a prospective 3-group randomized double-blind longitudinal pilot study of 36 women with breast cancer stages 1 all the way to 3A. The groups were divided into 3 separate groups. There was a group that received the cranial stimulation as an adjunct therapy to chemotherapy. There was also a group that received the placebo cranial stimulation with their chemotherapy, and simply they were just not really, they were hooked up to a electrical stimulation unit, however no current or voltage were applied. And then lastly, there was a third control group where they received no form of cranial stimulation as an adjunct to their chemotherapy. The purpose was to ultimately decide if the cranial stimulation helped reduce symptoms of depression, anxiety, fatigue, and pain that are often associated with chemotherapy. Unfortunately, the results of the study weren't able to distinctly reveal any identifiable measures. There were some slight decreases in subjective reports of depression in subjects receiving cranial stimulation. However, nothing outstanding. Subjects would report on a weekly basis via telephone, where they would answer questionnaires, subjective questionnaires in regards to their pain. They would answer scales that would report their level of anxiety, how much pain they were feeling that week, their level of depression, and how these ultimately affected their performance in functional activities and self-care needs. For future research, I would suggest to conduct a study on a larger population. As stated, only 36 women were performed in this trial, and I think only approximately 13 or so actually received a true form of cranial stimulation. I would also consider doing it in a more dispersed area. The subjects of this particular study participated in research at Virginia Commonwealth University and at the University of Virginia. So kind of spread it out in a more geographical location could maybe show different results. Also, to consider other forms of modalities for the use of improving symptom management for depression, fatigue, anxiety, and such. not specific to cranial electrical stimulation, but also ultrasound could be considered. Other types of adjunct exercises, or as previously stated, aquatic therapies could be used, and would like to see how symptoms are managed with these. Okay, some of the big take-home points, kind of clinical pearls from this case study. As a therapist, it's really important to not only educate the patient itself, but their caregivers as well, and to motivate them and kind of give them hope that their condition is going to get better, and allow them to see the progress as they're improving. Also, you want to stress the importance of social support system. The patient's daughters are really concerned about their mother's condition, and they want to help as much as possible, as well as her husband. So it's important to identify roles in which these third parties are able to assist the patient throughout their rehabilitation program. It's important to stress the importance of patient autonomy to help restore their independence. The patient currently struggles at home with self-care needs and management of her household. So throughout the rehabilitation program, the patient's going to be able to notice that certain activities are going to begin to get easier, and they'll notice an improvement in autonomy. Most importantly, because the patient had all of the lymph nodes removed from the axilla with her breast cancer, she's going to be battling this chronic long-term condition. It's important that she stays compliant to her home exercise program, as well as continuing physical therapy and other adjunct therapies as well, such as her chemotherapy and radiation. And then lastly, the patient reports subjectively complaints of depression, and she has anxiety and fear issues, mainly because she doesn't feel quite stable yet with that left upper extremity and the weakness and the swelling that she demonstrates with. It's important to note that these changes should get better as the patient gets better and as they become more functionally independent. If changes aren't really noted in the patient's social emotional status, other parties could be included, such as psychology, to help address the patient's issue. Here's a list of our references, and we thank you for tuning in. Have a great day.